Yeah. We can hear you. Hello, everybody. Greetings from Iowa Diabetes. Welcome to another Facebook Live session from us. Did you know people with diabetes spend about 2.3 times higher in medical spending versus those without diabetes? Today, we're going to be talking to Dr. Jamie Pitlick and Dr. B about diabetes meds on a budget. For all those of you who are tuning in, be sure to post your questions in the comments and we will address them right here. I'm going to be bringing Dr. B in right quickly. Yes, Dr. B, over to you. Hello, Dr. B. Dr. B, can you hear us?
Well, good afternoon, everyone, and thank you for joining us today. And as usual, I had some audio troubles and so forth. Thank you so much for joining today. Maria, are we ready to go?
Yes, we are.
Yes, we are. Excellent. Well, thank you, everyone, for joining today. I'm Dr. Bhargava, and you can also call me Dr. B. Very excited today about what's going to happen today. I have had so many stories about our patients who have had substantial trouble with cost of medications. One particular story about Joe, she, late 30s, I started her on an insulin and then didn't hear from her for 3 months. And then she comes back 3 months later. She did not start the insulin. Why? Because she could not afford it. And I said, Joe, you could have called me. And she said, I tried to call you from the pharmacy, but your phone lines were too busy. And I felt really horrible about the cost and how it impacted her life for those 3 months. The point is, diabetes medications are extremely expensive, and we got to get a handle on this. And this is why we are here today. Before I introduce our speaker today, I have a question for you all. So on a scale of 1 to 5, 5 being the highest level of frustration that you may have regarding the cost of medications, please type in your number now, how frustrated you are with the cost of your medications. And again, choices from 1 to 5, 5 being the highest. Maria, are we still on?
Yes, we're still on, Dr. B.
Okay. All right. So I'm not seeing any comments or anything. So if any numbers come up, please do let me know. Otherwise, I'll move on. Yeah, I think the comments are not coming in as yet. So a very exciting session today. I think there's a bunch of things we'll talk about. What are the top 5 things your doctor or your pharmacist should be talking to you about? That's one key thing. And then the big one, the cost of medications. There are so many tips, and we really have brought an expert that I rely on a lot. So Dr. Jamie Pitlick is a pharmacist. She has been embedded in our clinics. She's also faculty at the Drake School of Pharmacy. and she's very, very passionate about diabetes and has always been very willing and wanting to go above and beyond to find the right and affordable option for our patients. So I could not have brought a better expert for you today. So without much further ado, let me introduce Dr. Jamie Pitlick to go over the pains about your medications.
Yeah, Dr. B, thanks for having me. The one thing that I really want to highlight that you just said was finding the right medicine for the right patient in their situation, and that's something that I do every single day, and it is a passion of mine because although I can lower your risk of complications by giving you the most expensive drug, if you can't afford it, you can't take it, you're not going to get any benefit from that drug. And so whenever I'm working with patients, I really do try to find that balance of finding the best drug for them based on the clinical situation that they're in. Like, what are the symptoms that they're showing? What's the disease states that they have on board? But also, what can they afford and what side effects do they have? And also look at drug interactions as well. So it's a passion of mine to try to find the right medicine combination for all of the patients to make their situations better. As a pharmacist, I've been working for within long-term chronic disease states for about 10 years now. And all of these disease states, like diabetes and high blood pressure, they're so hard because many times patients don't feel bad. And so why take a medicine when you don't feel bad? Especially if that medicine can actually make them feel worse. So although these medicines can maybe have a reduce your risk for a heart attack or kidney disease, we've got to find that right combination for them. So I really try to work with patients, and I work with many doctors, many nurse practitioners to help find that right combination to help make patients' situations better. And whenever we're working with the team, things that I need my patients to know when they're talking about their drugs are I need them to know what their medication is used for. So that's one of the 5 things that I think they should always know. So knowing the disease state that it's used for and then the dose. In addition, I want you to know how you should take it, meaning should it be taken in the morning on an empty stomach? Do you need to take it with food? And why you need to take it with food, if that's the case. And then where do you store it? One of the misconceptions that I get a lot, patients storing insulin in the fridge all the time. Unused insulin should be stored in the fridge, but as soon as you inject it, that insulin can be stored at room temperature, so about 75 degrees, and it can be stored at room temperature for, depending on the insulin, 28 to 56 days. And that, if it's stored at room temperature, it's actually going to be more comfortable to inject. So all of these little tidbits are important to understand. The other thing is to know what is the most common side effects to expect from those medicines, so that you know if you're having one of those side effects, so that you know if you need to reach out to that doctor or your pharmacist to talk more in depth about it. Diabetes in particular right now is a very expensive disease state because not only are you paying for medicines, you're paying for many cases testing supplies. And many of the medicines and many of the testing supplies are brand name. And what that means is brand name is typically made by one drug company, and it's very, very expensive. Once you go to a generic medication option, oftentimes those prices slowly decrease. One of the examples right now is insulin. Most insulins are considered brand name. Right now we have one generic insulin on the market, insulin Lispro, but still the cash price of that is over $100. And I think Dr. B and I can both attest that the price of insulin over the last 10 years has gone up threefold.
And I'll say this. I'll interject here because I feel very passionate about this one. The cost of insulin is extremely challenging, and I really don't understand why and how a medicine as essential as insulin, which has been in existence for almost 100 years now. Right, we're going to get the 100 years anniversary of insulin soon. How come? And then when these branded insulins now have been there for 15, 20 years. And more. How come they're so expensive? So that's really a pet peeve of mine, and I'm hoping you will shed some light today about the insulin costs and how people can reduce that cost. Before you jump into that, Jamie, I just wanted to. I think the top five is such an important thing. We felt right. We are missing out. Doctors are so rushed. Pharmacists are so rushed. Everybody has these things to do that patients are missing out. And this is for this reason. If Maria, I can share my screen. I would just share with you at the Iowa Diabetes portal. We actually ended up putting these top five for a lot of diabetes medications, and a bunch of pharmacists allowed us to do that. So I'll see if I can share my screen, but if not, we'll carry on. If I can, I'll bring it back later on. But those of you who are not part of the portal, join, and you can see the top five things your doctor should be telling you. And also all the cost savings that Jamie will talk about today, you can find many of them there as well. Back to you, Jamie.
Yeah. So the medication cost pathway is very, very complicated. There's 2 to 3 middlemen involved between when it goes from the drug manufacturer and it goes through 2 to 3 hands before it reaches the patient. And at each of those step points, the cost increases because they've got to make money at the middlemen steps. It's a very inefficient system, but it's the system that we're having to deal with. And so as I'm working with patients, I'm trying to figure out what are the different pathways that I can utilize to help them reduce their costs. And I really have 3 different pathways that I talk about whenever I'm working with patients. And it depends on what insurance status they have. And what I mean by that is, do they have government insurance like Medicare or Medicaid? Do they have private insurance that they've either purchased themselves or got through their job? Or do they have no insurance? And that really guides my talk because there's certain resources for each of those different populations. So I did want to talk about those here today. The first one that I'll kind of go through is, what do you do if you don't have insurance? Recently, so within the last 1.5, 2 years, the major insulin companies have come up with savings programs for each of their insulins. They've actually recognized that insulin costs a lot, and they're trying to make sure that populations that absolutely need it can get it somehow. So there's 3 different major drug companies that make insulins, and they all have these insulin saving programs. We're going to put the links on Facebook for you, but we've got the Value Insulin Savings Program offered by Sanofi, and that's going to be Lantus and Apidra are going to be the main ones there. But they offer $99 per month. You can get some insulin from them if you have no insurance. All you need is a valid prescription from your doctor. Lilly and Novo, so that's going to be the Lilly Cares, which is Humalog and Basaglar, and then Novo, which is going to be Tresiba, Levemir, and Novolog are going to be the main ones there. They're going to have similar programs for you. The specifics are slightly different on each of those, but essentially it's the same. If you don't have insurance, they're trying to get you that insulin at a reduced cost so that you never go without therapy that you need. The last one that I talk about is the Rely On brand of insulin. So Walmart probably is the most famous one that offers this, but there are other stores that offer this Rely On brand. What the Rely On brand is they'll take older insulins that have been on the market for a while, like Novolin N and Novolin R, and offer them at reduced prices through that Rely On brand. So if you're on Novolin N, you can get a vial of insulin over the counter. You don't even need a prescription for it from the pharmacy for $24 for one vial of 10 mLs of insulin. They also have a program that they've expanded to the pen versions, and I think that's about $45 for 5 pens, which is an amazing price. Now, these insulins are a little bit older. They come with slightly more risk for low blood sugars, and you do have to take at least that long acting has to be taken twice a day. And then the Novolin R, it's not as fast acting. So instead of taking it 10 minutes before you eat, you do have to take it 30 minutes before you eat. So there are some specific instructions that you should get from the pharmacist or from your doctor before switching over to those products.
So, Jamie, I'll kind of interject here. I think this is very good. So, what I say is there are insulins out there. If you cannot afford the brand name insulins, go for if the choice is no insulin versus NPH and regular, go for it. These insulins still work. They have been working for almost 100 years, especially the regular insulin. Work with your doctor very closely on making the switch. But just know that the 1,000 units of NPH, $25, so that can go a long way. So yes, our preference is brand name, but if you can't afford, you cannot afford, and then NPH and regular are still choices. So in this day and age, people can still afford by using these insulins. So thank you for telling us about that. There are some comments, things on the online. So a lot of people rated their rating from 2.5 to 5, different ranges, a lot of 3 and 4s and 5s. So something to be aware that that's definitely a challenge for patients. Jamie, you might be covering this in a little bit, but I'll just at least point out, Myra mentioned the cost of Freestyle Libre, and it would be nice if it would be more affordable. So we'll look forward to your thoughts on that. I think if you want to answer that, and also there's another thing that I partially understand, and you probably understand more, the drug coupons from pharma companies. How do they work? I think patients have that option available. Just shedding some light on how do the drug coupons work and how should patients use it?
Yeah, drug coupons work very variety of ways, meaning pay up to $25, pay up to $5 for a year. So there's a lot of different programs out there. Usually there's a set limit on them, meaning that coupon will only reduce it up to $150 or $200. So you want to be aware of that as well. So the manufacturers will put out and say, we'll take what the drug costs, and even if it's not covered, we're going to take up to so much off of that price for them. And then the drug company pays the pharmacy along with whatever your insurance company will pay. If your insurance company covers it and pays the pharmacy down to, I don't know, $25, and then the coupon takes it down even further from there. If your company if your insurance plan doesn't pay for it at all, and it's normally a $300 drug, the coupon may take off $150 or $200. It just depends on what that specific coupon says. But most of them do have set limits. So it may take there's a lot of drugs right now that are in the $500 to $600 range. So it may take one of those from $500 and take it down to $350. Now, is $350 a good price for most people? Usually not. So you really have to understand how those coupons work. They also typically have a duration. So whether it's 6 months or a year. What most patients don't know is they simply have to call the drug company to renew after those 6 to 12 months. And most of the drug companies want you on their medicine. So most of them are going to give you at least an additional year or 6 months to go back to it. And so that's really an option for many people. If you weren't given that prescription coupon at your office, or if the pharmacist didn't offer it to you, just by researching out on the internet really quickly, you can typically find if your drug company has one of those available. For example, new product on the market, Ozempic. If I was looking for a coupon for Ozempic, I would search on the internet and search Ozempic. And one of the first things that comes up is going to be the Ozempic website. And on there, typically one of the first things it's going to say coupon. And so you could even research and say Ozempic drug coupon, and it'll bring you right to that website. You usually have to answer 1 or 2 questions, and then you can print off your coupon right from your computer. As long as it's coming straight from that drug manufacturer's website, it's typically a valid coupon, meaning it's not some no other company is linked in with it. And so you want to make sure it's from the drug company's website.
And Jimmy, let me add something here. So we put together all these coupons and prescription assistance programs on Iowa Diabetes portal as yet. So if you add your medication there, then in your list on the website, you'll be able to see if a coupon or prescription assistance program is available, and you can directly click on the link. You can call them through the site and so forth. There's a bunch of options available to be able to see all these options once you join Iowa Diabetes portal. So now with coupons, I have a question. I have a ton of patients who are on Medicare and Medicaid, the government-based insurances, and most of these coupons do not work for Medicare patients, and that's very frustrating. It's like, great. So my question is, and the patients would wonder too, why? Why don't they work for Medicare? And then what help is available to them?
Yeah, it is a complete frustration for me on why they don't work for patients with Medicare, Medicaid. It has to do with you can't undercut a government price. So if you have government insurance, you can't reduce that at any more than what the government offers. Now, before I go into that, I do want to add to the cost of the coupons. Many times I like coupons for those patients that have high deductible plans. So they have to pay $4,000 out of pocket before their drug insurance will actually pick up and start taking any coverage. These coupons are perfect for some of those patients because they can quickly bring down those deductibles. Even if you're not paying those, many times the insurance companies will count that towards your deductible. And so essentially you're getting it paid off. For the Medicare Part D options, actually we can go to the drug companies for that as well. But there's a little bit more red tape around what you have to do. So there's a process that I have to walk through for most of the patients. In order to qualify for prescription assistance from Medicare Part D, you have to first prove that you don't qualify for something called low income subsidy. This program is also called Medicare Extra Help. And so you have to apply for that. And then if you qualify for that, that's absolutely great. It reduces your medication costs quite a bit, brings down to, I think it's less than 25% if you get partial help. If you get full help, it brings you down for like $3 for generics and $8 for brand names. So it substantially brings all drug costs down, not just the brand name expensive ones. So if you qualify for that, great. If you don't, we can save that denial letter, and then you have to prove to the drug company that you've paid about $1,000 out of pocket. And then once you prove that, they'll actually give you your brand name products through prescription assistance programs. The main products that I work with patients on for this are going to be the expensive insulin products, especially if you're on really high doses of insulin, needing 2 to 3 packs of insulin per month. You really need that out of pocket really quickly, and I can usually get you help with that. But you have to prove that you don't meet any of the qualifications for the government programs. And so you have to do that first step of actually applying and potentially getting denied that extra help. Right now, with COVID-19 going on, the major three insulin manufacturers have actually waived the out-of-pocket requirement. So as of right now, they're not making patients meet that $1,000 out of pocket. The last time I checked, and I checked last week through some of that information.
All
And now
right,
they're
Jimmy, thank you for all this information. So we're getting closer towards the end of our conversation. I think apart from medication, it's equally important to just talk briefly about meters, strips, and supplies and Libre question that came up as well. So can you speak a little bit to some of the options available there? And Maria, you can share slides if possible. Go ahead.
Yeah, so testing supplies are also really important to talk about. Whenever we're doing testing supplies, I'd like you to get the most affordable ones that you can afford, but also reliable. So you want to make sure whatever you're getting is a high quality product that is actually going to give you a reliable number. So that's the number one thing that I do want to make sure that we're getting things maybe from a reliable source. Sometimes if we get them um, at just a generic online store, we don't know where they're coming from, and we want to be aware of counterfeit strips and some of those things. Once we are determined that they're a reliable source, there are some generic type meters as well. Walmart has that same Rely On brand. It has a Rely On meter and Rely On test strips that are reasonably affordable and actually are pretty reliable in the numbers that they provide. Um, in terms of uh, going outside of insurance, there's actually some different programs that you can get online. Some of the names of them are One Drop, My Sugar, and Livongo. And if Maria, if you can share the screens on those, if possible, that would be great because it actually on the screen has all of the values and the prices for each of those.
Well, we'll share that information. Maria, right now the black screen is showing. So let's keep moving on. So Jamie, to kind of end this conversation, let me ask you a question, and slightly provocative perhaps, but what have you noticed? What is one thing that patients hide from you that you find the most problematic? Are there things that they don't share with you, and
Yeah,
why they should share them with you?
yeah. Patients sometimes try to tell me what they think I want to hear, meaning they tell me that they're taking all of their insulin doses every single day. I'm taking 3 doses of my mealtime insulin before I eat. I never miss a dose. And I think if that's true, that's fantastic. But if it's not true, it can hinder some of the care that I can provide them. Because if they're not taking their insulin, and I have to make a dose change because maybe their blood sugars are a little bit high after they eat, um, and then they go to take it again, I could potentially cause a low blood sugar because I didn't know they weren't taking their medicine. So adherence and making sure that I really understand how a patient is taking their medicine is probably what I see patients try to hide the most, but it's actually the key to everything as I'm working with patients.
Got it. Myra has a comment. She talks about the fact that Blue Cross Blue Shield is actually giving Livongo for free. And then many employers are doing the same as well. There are many employers who will have a contract with one of these companies and provide this as part of a package. And not only that, many of these companies do come with some support for you as well. So it's pretty fascinating. The world around us is changing. So keep that in mind. Well, let's bring it back. One more question, one final question. Local options. What are some of the local options for patients with diabetes to afford their medications? You go ahead with a couple of names, and then I have one thought as well.
Local options here in Des Moines, we have Safety Net RX, which takes near expired medications from around the area and is able to get them out to people who need them. The one thing that they don't provide are refrigerated products. So all of the insulin, they don't have that, but they have a lot of pills and other resources. I'll let you go next.
All right. So, from my standpoint, we do a lot of clinical research, Iowa diabetes research. We've done about 100 diabetes trials, and the benefit to the patient is immense. They'll get these medications, and sometimes there's placebo, but most of the time it's an active comparator. So they get their medications. People have received insulins for a year, both their long-acting and short-acting insulin. Many times they'll get their sensors, and most times they get supplies and so forth. So research is a care option we need to think about. There are a bunch of free and low-cost clinics. You could consider those options as well for at least free care, and some of that money you could perhaps use for your medications. So let's see if there are any questions from the audience. Please feel free to ask if there's anything we can answer. I'd like to thank Jamie for joining today and for sharing some of the words. So, what are your three key take-home messages, Jamie, for us today?
Well, before I did that, I feel bad because I haven't talked about the Libre that much, and I know there's been a question about it.
All right.
And so Libre, if you do not have government insurance, has a coupon that is automatic through most pharmacies. And this would be the 14 days Freestyle Libre. That it brings their price down to $75. That $75 is for the entire month. So that would be 2 sensors. If you're using your cell phone to be the receiver for it, you don't have to buy the receiver. If you have to buy the receiver, that coupon will bring that price down to about $65. Both of those are normally over $100. Some insurances, at least in our area, will bring that cost down for those month supply of sensors even further. So I know in the Des Moines area, some insurances will bring it down to $35 a month, but it's only 1 or 2 insurances. So what I would say to get that price down, have your doctor submit a prior authorization or have yourself submit a letter. Keep letting the insurance companies know that you want these products so that they'll start to cover them. If they don't know that these products are wanted and that they're of a great value, they may not know. So just being that advocate for yourself.
All right, let's sum it up. Your top couple, 2, 3 points.
Yeah, so the 5 things that I want you guys to take away from knowing about all of your medications: know what they're for, know the dose, know how to take it, how to store it, and what it can possibly cause in your body. And then I want you to be able to know some of the resources that you have available to you to reduce those drug costs. And I know I've covered a lot, whether it's drug coupon, the low income subsidy program, or just those insulin value savings programs.
All right, so things keep improving in a general sense. There is a lot of new insulins going to come on the market, biosimilars. They're going to drive the price down. So hope is on the way. For the meantime, just stay healthy, take your medications, seek help. A lot of resources out there locally for you. There's a question from Shanzi about, does the Libre transmit now like Dexcom, or does it have to be scanned? So Libre is what we call the flash glucose monitoring, and I was involved with this for several years, many years ago. It still has to be scanned at this point. This is the way they have structured the system. And that's why it's called flash glucose monitoring as opposed to continuous glucose monitoring. Thank you, everyone, for joining. From my side, just keep taking your meds. Figure out a way. There's a lot of things you can do to reduce the cost of medications. Reach out to us if you have any questions. Maria, back to you for getting us to the end.
Thank you so much, Dr. Jamie Pitlick and Dr. Bhargava. It's been an amazing session so far. Next week, we've got another special guest who will be joining us, and we're going to be talking about protein. So I think it's going to be a great topic for us to discuss, and yeah, looking forward to it.
Yeah, so what has driven us our conversation about the topic is how do I get my protein? And the reason we thought this would be very valid to do right now is because of the issues we are seeing all across Iowa with the meat plants and across the nation. So if our meat supply chain is at risk, and the grocery stores here like Hy-Vee is rationing meat, we want people to get their protein, and we have some great tips for you next week on how to get your protein if meat is at risk. Randy has a question. How close to a meal should I take insulin? Do I need to be in a firm eating schedule and you take certain amount of insulin? So you take the Novolog. Novolog, 5 to 15 minutes before the meal is the ideal time. After becomes too late. If you can do 5-15 minutes before, right before. But these insulins are designed to be taken before the meal. If you can keep your numbers down, there are many options, Randy, including again, your doctor. If you need specialized care, Iowa Diabetes Care, we see patients all the time. We can see people for free. We see them without insurance directly, but we can help you as a free visit, courtesy visit. There are many options. Reach out to us through iowadiabetes.com. Thank you so much for joining. Next week we'll see you and talk about how do I get my protein in this day and age. See you then. Thank you so much for joining. Have a great day.
Thank you. Bye bye.